Here is the part 3 of beta blockers. Blockage of beta 1 receptor blockers, it will reduce the force of heart and also it will reduce the heart rate and reduce the renin secretion. Beta 1 receptors primarily found in heart. By blocking these particular receptors, it will eventually create these 3 types of action in our body: reducing the force, reducing the heart rate and also renin secretion. By reducing the force and also heart rate, it will reduce the cardiac output. By reducing cardiac output, it will reduce the blood pressure. If the patient is having hypertension which has high blood pressure, by giving beta 1 receptor blockers, the patient will get reduced force of heart rate and also reduced heart muscle contraction. Even it will lead to low blood pressure. So patient will go for normal blood pressure. In beta blockers slows the SA node. SA node is the part of conduction system. This conduction system initiate the heart muscle contraction and producing the heart rate. These beta blockers act on SA node and this particular SA node is initiating heart rate. By acting on a SA node, it will reduce the initiation of heart rate. Next is it slows the heart rate, allows the left ventricle to fill completely and lowers the heart workload. These beta blockers completely and lowers the heart workload. So blocking adrenaline and noradrenaline, these many actions are happening in our body. These affecting the heart and also blood vessels to reduce the workload and also decreasing the blood pressure. In blood vessels, it act as blockers and also create dilation. By dilating the blood vessel, it will reduce the blood pressure. Blockage of beta 2 receptor blockers. These beta 2 receptors primarily found in our smooth muscles and also airways. By blocking beta 2 receptor blockers, it will increase the airway resistance and also vascular resistance. This is how beta blockers works. And next is pharmacokinetics. 4 major things happening in our body. First one is absorption. Absorption will vary by the route of drug administration. By giving oral route, the absorption occurs in oral cavity. Next is distribution. The drug is distributed throughout the body because beta receptors present in our body in heart, lungs and smooth muscles and also adipose tissue. So these drugs distributed in our body as wide distribution. Next is metabolism, the chemical reaction of drug converting into another substance to reach the target cells. It occurs in liver, so it is a hepatic metabolism. Last one is elimination. After the action of this drug, the waste material will be eliminated by the kidney, such as called as renal excretion. Through the kidney, the waste products will eliminate via the urine. Next is indications. Indications of beta blockers are hypertension. This is the primary goal to reduce the blood pressure. Next is angina. By giving beta blockers, it will reduce the heart muscle contraction force. So it will helpful for chest pain. Next is heart failure. By giving beta blockers, it will reduce the cardiac workload. So heart failure will improve. Next is arrhythmias. Irregular heart rate. By giving beta blockers, it will reduce the increased heart rate. So it will helpful for the arrhythmias. Next is migraines. Especially propanol will be given for migraine patients. It will reduce the headache, anxiety. By reducing the cardiac workload, heart rate and also increasing the vasodilation, it will reduce the blood pressure and also helpful in anxiety. Next is contraindication. We should not give beta blockers to cardiogenic shock because it will create more complications in patients those who have cardiogenic shock. It will create further complications. Severe bradycardia, patient is already in decreased heart rate. By giving beta blockers, it will create complications for patient those who are having bradycardia, decreased heart rate. severe hypotension, we should not give beta blockers to severe hypertensive patient because it will reduce the blood pressure furthermore, so we should avoid. Next is atrioventricular block. These beta blockers also complicate this condition, so we should avoid. Next is unstable heart failure. By giving these beta blockers, it is suddenly reducing the cardiac workload, will lead to further complications in unstable heart failure patient. So we should avoid beta blockers for these conditions. Next is adverse effects. Patient will have fatigue, tiredness, cold hands, constipation, because these beta 2 receptor blockers reduce the smooth muscle contraction, so it will lead to constipation. Some will increase the peristalsis movement, so it will lead to diarrhea, dizziness because of reduced blood flow to the brain. Confusion also occurs. These drugs will affect the GI tract, so it will lead to nausea and vomiting. Next is fission assistant role. As a PA, while giving beta blockers, we should concentrate on regular monitoring of blood pressure, because patient will go for hypertension suddenly, so we should connect a monitor for regular monitoring of blood pressure. Next is regular monitoring of heart rate, because patient will go for severe bradycardia, so to prevent that condition we should do regular monitoring of heart rate. The next is monitor adverse effects. We should monitor the patient if they are developing any side effects from the drugs. Here is the summary of beta blockers. Targeted receptors types are beta 1, beta 2 and beta 3. By giving beta blockers, we are blocking these 3 type of beta receptors to perform. By blocking the adrenal effects, the medicine blocks the epinephrine and causing the heart to beat slower and also with less force. Next is improved hemodynamics, reducing cardiac output, reducing peripheral resistance and also lowers the blood pressure. Primary therapeutic indications are hypertension, angina, heart failure, arrhythmias and migraine, anxiety. 3 generations of beta blockers are there: first generation, second generation, third generation. In first generation it is non-selective, it blocks both beta 1, beta 2. In second generation it only blocking the beta 1 receptor, so it is selective. In third generation, selective or non-selective, it will cause the major function as a vasodilation, it will reduce the blood pressure. Next is vital contraindications we should avoid in cases of cardiogenic shock and also severe bradycardia patients and unstable angina under heart failure patients. Thank you.